Hi, welcome to my channel. This is Dr. Ravel Martinez with another tip for us foreign graduate veterinarians going through the ECFVG process to get licensed here in the US. Today will be tip number 5 for CPE surgeries. It's a continuation of the previous videos that I did. Let's start with the first tip for today. Choose and pick your suture that you're planning to use during the exam. There are several sutures that you can use. There's PDS, there's Vicryl, there's Chromic Gut, and then there's Silk if someone is still using it. I know some are still. But my personal favorite would be SecureAcryl. SecureAcryl will have an absorption time of about 80 to 120 days, which is good enough time length for the suture to provide strength and apposition to make sure healing is done prior to it dissolving. Whichever suture you prefer, whichever suture that you like, make sure you research how long that suture lasts, just in case the examiner asks you why you chose that suture. Whatever you're comfortable with would be just research it so that you'll be able to answer some questions about your choice. My thing about suture though is I always like to go big with regards to the suture. If it's a big dog, I will use an aught suture. If it's a medium dog, I sometimes still use an aught. If it's the smallest I would use, if it's a cat, personally I would do 2/0. Just because 3/0 for me, I think it breaks whenever I try to knot it. So whichever one you prefer, the main thing would be, so right before you start surgery, ask for that suture. I would always personally remove the suture out of the cassette to let some of the memory of that suture go away. It's difficult, especially if you're using a bigger suture and it still has the memory of the cassette in it. So I personally would take it out first before I start my first incision so that I'm freeing up that suture from the cassette and having some time to remove some memory of it, so you're not fighting with the suture whenever you're trying to make knots or when you're trying to get the free end of it. So that's my tip. Always take out the suture from the cassette first before you start your surgery to remove some of the memory. So I know the last video that we did, we were already at, making sure to not have as much bleeding whenever we're ligating the blood vessels. The main thing would be to, after we're done with all of the ligations, we got the 2 pedicles and then we got the uterine body. Of course, before you let it go, you have to show it to the examiner. But right before you close, make sure you're lifting that body wall, inspecting inside, see if there's any pooling, see if there's something that is kind of fishy, that this blood is coming up, or just to make sure that there is no bleeder, hopefully not, when you close. Another thing would be when you dab, or if there is a little bit of a bleeding, when you dab, always make sure to use just one piece of gauze. I know sometimes we're rushing and especially if there's a bleeder, we take more than one gauze, and that is very tricky because if you get more than one and it gets soaked, that might be a chance, hopefully not, where you might forget gauze inside the body wall. My tip would always be use one gauze at a time. Don't grab 2 or more and end up, hopefully not, leaving one inside the body cavity. Very bad idea, very bad scenario. I've heard of it happening before. It hasn't happened to me. So just to get a clean slate that it doesn't happen to anyone, always just use one gauze at a time. When we're closing the body wall, we always have to remember which part or which layer is the holding layer. It will always be the external rectus sheath. Again, external rectus sheath is the holding layer for when we close the abdominal cavity. So 5 to 10 millimeter of external rectus fascia or linea alba is all you need on each side. Is the bite that you need to make or to take to make sure that you have enough hold of that tissue when you try to close. The main thing would be is to have a plan A and then a plan B. Plan A, some people, they're more comfortable closing with cruciates. Some people, they're more comfortable closing with simple interrupted. Some people are comfortable with just doing a simple continuous. I personally do a simple continuous, and so far, knock on wood, I've never had any complications. But whichever one you're comfortable with, let it be your plan A. But let's say it took you so much time to get everything done. You're looking at the clock. Oh goodness, it's almost time. Have a plan B to, okay, it will take me longer to do simple interrupteds or cruciates, and I'm running out of time. I might as well do a simple continuous. It's still a good option to do a simple continuous, but make sure you practice doing it appropriately, because if you don't practice it, sometimes, and chances are, either you don't space it properly or you miss something. But spacing it properly is the main thing. The other thing would be if you do simple interruptus or cruciates, make sure as well that you're spacing it appropriately, because after you're done closing that abdominal wall, I would always recommend to get a mosquito forceps and check if there is any areas where that mosquito forceps will go through your incision. No one wants to have a post-surgical herniation, so make sure it is properly spaced. Make sure that it is tight and it's holding. But the other thing too is make sure you don't include fat or omentum in that closure. So I guess my time is up. I'll make another video for a continuation of this topic. For all of us studying for our ECFVG, NAVLE, and for the exams that we're going through to get licensed in the US, you can do it. You're almost there. And if you have any questions, you can always ask me. I'll try to post pictures on my Facebook. My Facebook page is DVM Rovell, R-O-V as in Victor E-L, and you can ask me any questions there. I'll be able to post pictures there because I don't know how to post pictures on videos yet, but someday I'll be able to do it. But again, good luck to everyone trying hard and studying hard to get licensed here in the US. You're almost there, and after you're done, all of this will be a thing of the past, and you'll just be like, oh yeah, I remember that time when I had to study hard. It will all pass, and at the end of it all, it will be very beneficial for you and your family. Thank you very much, and good luck everyone. Bye-bye.